Hello class, my name is Amber Gagliotti, and this week I'm going to talk to you about the drug effects on pregnancy. Any drug can affect an unborn child. This includes prescribed drugs by a doctor or illicit drugs such as marijuana, cocaine, alcohol, things like that. Every drug can affect a child in a different way. Some drugs are stronger than others. For example, marijuana is a drug that has a less strong effect on the fetus. Marijuana is a drug that affects the child just as tobacco would. Marijuana deprives the child of oxygen, which can in turn create a higher chance for miscarriage, low birth rate, early birth, things like that. Some drugs that have a higher tolerance on the baby or higher effect on the baby is cocaine. Cocaine is a drug that affects the baby straight through the placenta. The placenta is the outer wall that protects the child. The placenta provides the baby with oxygen, with nutrients. Cocaine attacks the baby through the placenta and then enters the baby's circulation. Traces of cocaine can be found in the baby's umbilical cord, in their hair, and any bywaste, like the products that they produce while inside the womb. Other drugs that have a high effect on the child are methamphetamine, heroin, things like that. These drugs are highly addictive as well. Not only does the mother become addicted to it, but the unborn child also becomes addicted to it. This means that when they are born, they also come through a withdrawal, just like the mother. Withdrawal symptoms for babies include abnormal sleep habits, problems feeding, things like that. All these drugs have a lot of the same effects. They can lead to miscarriage, they can lead to low birth weight, they can lead to developmental factors down the road. Some of them create anxiety disorders, some of them create learning disorders such as ADHD, where the children have problem focusing. They can also lead to physical disorders because of abnormal growth inside the womb. One thing that we do need to take into mind is that there are treatment for these pregnant women. You must be careful though, because a lot of the treatment that is used are things such as methadone. Methadone is also very addictive. Some of these drugs used are used to try and help the mother wean off of the drug of choice, such as heroin or methamphetamine, but in turn, the child then gets addicted to the drug that is trying to help them. Although these drugs are less harmful to the child, they are also highly addictive.